the Interfaith Center for Public Policy. We appreciate the reporters from across Virginia who joined us today to be a part of the first of several local events, really highlighting the need for paid sick days and for our upcoming General Assembly to pass legislation to set a standard on paid sick days in Virginia. And so we have an incredible lineup, but we're going to start first off with the Richmonder of the Year, Dr. Avula, who's really been leading our effort in the region to get a handle on this pandemic before us. So Dr. Avula, tell us why we in Richmond area need paid sick days.
Thanks, Kim. Happy to be here with you all this morning. And yeah, obviously it's been an incredibly intense year thinking about COVID and its implications for all kinds of residents across our Commonwealth. And I'll say a couple things just before I jump into the impact of COVID and how that has at least clarified my thinking about the need for a paid sick leave. But I think in health across the board, the last 20 years has brought on this deeper and more holistic understanding of what drives health. And so in our field, in health and public health, we talk about the social determinants of health, the reality that things like housing and family stability and income and employment actually have way more of an impact on your opportunity for health than even your health behaviors or your access to healthcare. And I think we continue to see that across the board, that some of those basic drivers of health and opportunity are exposed in the midst of something like COVID. And so when we think about this through the social determinants of health lens, we recognize that health and economics are just inextricably intertwined, and that has certainly been the case as we've looked at how this pandemic has impacted residents, at least for us here in Richmond and Henrico. But I know that this has been the story throughout the state and throughout the country. Every day, our case investigators, our contact tracers are on the phone with individuals, with families who they're saying, hey, you've tested positive for COVID, or you've been exposed to somebody who's tested positive for COVID. And that leads to the next very challenging conversation, which is a directive from us that you need to isolate if you've tested positive for 10 days before you can be cleared, or you need to quarantine yourself. You need to stay home for 14 days while we figure out whether you're brewing the disease or not. But for so many of our residents, that becomes a very real decision about, am I going to do what's best for public health and quarantine myself for 14 days at the expense of a paycheck and the ability to put food on the table for my family. And so we just, every single day we're talking to residents who are being put in this position of having to do what's right and good for themselves and their families, and then what's right and good for any potential people that they expose themselves to. And that's a really difficult decision to make, and ideally people wouldn't have to make that decision, and if they had the option to have some paid time off to do what was both best for their own health and for the public's health, this would be a very different calculus for them. But I think this is doubly, if not more so, exacerbated beyond the people that we know about and talk to, because what we've also seen, particularly in low-income communities and minority communities who disproportionately are working jobs where they don't have access to sick leave or any kind of benefits, they're not even getting tested, right? Like if they're symptomatic and they're they know what's going to come. If they get tested and they test positive for COVID, they're going to be held out of work. Again, it's an untenable decision for so many people. And so I know that there are thousands of people who are not getting tested, who are not picking up the phone when the health department calls, because for them, it's literally life and death, right? Like, do I not bring home food, income, rent for my family, or do I take this call and know that I'm going to have to stay home for 10 days. And so I think COVID has just made so abundantly clear that things like a paid sick leave benefit not only benefits that individual and allows them to make the right decision for themselves and their family, but it has implications for the workplace. I mean, the vast majority of our exposures and our outbreaks are happening in workplaces. And so if, particularly for that segment of essential frontline workers, had the option to take paid sick leave, we would see drastic reductions in the exposure and the potential for spread happening in those settings. And so, yeah, I think the last year for me has just made very clear the connection, especially with the communicable disease lens, between individual decision making and the impact that it has on an entire workplace. And I think at the end of the day, like, we know that people are healthier when they have the option to take time off and see a doctor, to take time off and recuperate at home, to take time off and not expose others. And we also know that economies are healthier when people are healthier. And so I think COVID, like nothing we've experienced, has just has really clarified the need for this really important policy right now.
There we go. Thank you so much, Dr. Avula. I think no one is clearer about the connection than you are. And so we appreciate that. We understand you're going to have to dash off. We have a lot of heavy responsibilities in saving all of our lives. So thank you for your work. And, you know, you are in our thoughts and prayers because we know the stress that you must be under in your position. So thank you so much for what you've done.
Thanks, Kim. Take care, everyone.
All righty. We're going to turn next. Dr. Avula may have been the person of the year for Richmond, but we're going to turn next to someone who is often considered one of the restaurant leaders of the year or of the years, and that is Buzz Grossman of Buzz and Ned. So Buzz, tell us about paid sick days and what you as a restaurant owner think about paid sick days.
Well, good morning. Paid sick leave for me and for my staff is just part of an overall program that people, a baseline that people really need to operate their lives comfortably. About 4 years ago, I got included in a national program that President Obama spearheaded. It was trying to remember the name, Agents for Change, or but one of the things we were emphasizing then was a minimum wage of $15 an hour. That was what was being discussed all over the country. We thought that was a good idea. It would give us some benefits, more loyalty, higher productivity, less stress for the management, no need for a second job. We included health insurance for full-time employees at a 30-hour work week. So there was a lot of things that were good, but unsustainable for us at the time because we were doing it alone. There was no governmental mandate to make this happen and work for small businesses, and so we had to end it because we couldn't afford it. There was no way for us to increase our prices because we're in a competitive situation with all the other restaurants in town. Yet we really needed it, and again, needed it to compete with larger corporations who are pulling away a lot of the labor force from the restaurant industry. So what I'm getting at is this paid leave, great. We're doing it 5 days for employees, but it needs to be mandated by the government so that everybody is on the same field. everybody has to have the same rules. And so that when expenses are increased, which this would increase it, not much, but marginally, we can increase our prices, which is what happens. The consumer ends up paying for any increases in prices. But it's okay. It's not a lot. There's a lot of other things we could also be doing, but this is just an isolated one case. I think it's fantastic for the industry. I think it's fantastic for workers. Anything that can increase the happy scale for restaurant employees, for me, is a good thing.
Awesome. Thank you so much for your overall leadership and commitment to both being good to workers in a way that is good for your business overall. So thank you for your leadership. Now we're going to turn to Josh Briere, who has worked in the restaurant industry and seen people go to work when they are sick. So Josh, could you tell us about this?
Yes, good morning, Pam, and good morning, everyone else. Thank you all for having me. And I want to particularly thank the Virginians for Paid Sick Days Coalition for the important work that you're all doing. Restaurant workers appreciate you standing with us, and we stand behind you guys and your push for a paid sick day standard. So my name is Joshua Briere, and I've been working in the restaurant industry for 6 years now. For most of these years, I've been balancing my studies at college, but for some of these years, I've worked up to 50 hours a week. And I believe that both full-time and part-time workers need paid sick days, because after all, a part-time job doesn't mean that you only work 20 hours a week. It often means you work 40 plus hours a week, just in several different places. It's the nature of the service economy. And as Kim was saying, I know countless restaurant workers who even before COVID went to work sick. And when COVID-19 began ravaging our nation in early March, right before things started shutting down, we really could have used paid sick days. There were few tests available, and many people just kept chugging along because they thought they had a common cold or spring allergies. And when you're in the restaurant industry, you just have to chug along quite often, because a day gone from work could mean no groceries or a late rent payment. And obviously I'm no scientist, so I don't want to pretend I know things that I don't, but I do really believe that if we had had a paid sick day standard before COVID, we could have greatly prevented the spread, not just in my industry, but across the board. In my 6 years of restaurant work, I have worked with single mothers. I've worked with folks aged 60 or older. I've worked with people suffering from food insecurity, as well as those riddled with excessive medical debt, among many other things. And like I said, I myself have worked most of these years as a stressed out student, balancing school and internships while financially supporting myself. And in all of these years, I have never met a rich restaurant employee. We are constantly finding ourselves in an anxiety-riddled, precarious financial situation. So for many workers, like the ones I listed above, when it comes to feeding your family and paying your rent or going to work sick, I don't know a single person who would not choose to feed their family or pay their rent. So we need to ensure that there is a safety net for Virginians when they get sick. It's immoral, in my opinion, to do anything besides that. Catching a cold should not get you evicted or leave your family hungry. And this issue is even more important now in the age of COVID. So we need a paid sick day standard.
Thank you, Josh. We're now going to turn to another Richmond business owner who does offer paid sick days, Mark Smith, who is the owner of Midas of Richmond. And Mark, tell us why you think paid sick days is a good benefit for your workers and for your business.
I think paid sick days is an absolute important component in a total compensation plan. You've got compensation for the way that people are paid. You've also got benefits, paid sick leave being a big one. No one in our company has less than 13 days of PTO on any given year. We build that into the compensation that grows as your tenure with us increases. It helps me keep a stable workforce. It helps me provide a good compensation package. It helps our customers see the same people over and over and over instead of having turnover. There's just a lot of good, financially sensible benefits to doing it. I fully support it. We've done it for years. We will continue to do it. And in years to come, we'll probably expand our offering.
Awesome. Well, again, we wish there were more businesses doing it. There are quite a few. The majority of businesses offer paid sick days, but there's a huge segment, 1.2 million workers that do not work in businesses that have this. And so that's the group that I think our coalition is trying to address with this proposed standard. Next, we want to hear from Reverend Dr. Faith Harris. The faith community has been incredibly supportive of trying to create a paid sick day standard in Virginia. Faith, can you tell us why?
Yeah, I think I'm unmuted now. Yes.
You're on.
Yes. One of the things that I would want to point out is that those of us who follow a Judeo-Christian background, the Bible is filled with mores and laws which demand justice for the land, for animals, for servants, and for all living beings. There's a text that says that oxen should not be muzzled when it's plowing the field. Why? It's not just an issue of compassion. It's also an issue of the oxen should have the right to eat from its own work. And so that is, if an oxen in ancient Israel is protected and given rights and justice, then I think for us, those of us who live in 2021, that we ought to be thinking about our human lives as equal to an oxen, right? That we want to see workers, hourly wage workers, be able to have the ability to care for themselves, to be able to take care when they need to take care, to go to physicians, to take time off to heal. Paid sick days are not simply an issue of compassion or care, but as we've already heard, that they make good economic sense, but they also it's really about justice. And we're all witnesses today, from listening to all of the speakers ahead of me, to the importance of justice for having hourly wage workers. And paid sick days are a justice issue. Laws that provide protection and guarantee the rights of workers are moral, and they reinforce the value of life over material wealth, and they establish the common good for all of us, because when we protect the most vulnerable, we're actually strengthening the hand and strengthening the lives and the rights of everyone. Paid sick days are a justice issue, and all faiths, as Virginia Interfaith Center's motto, all faiths believe in justice. The Commonwealth of Virginia cannot afford to ignore the rights of hourly workers any longer. And we need, as a moral issue, as a justice issue, as a common good issue, the protection and guarantee of paid sick day for hourly workers.
Awesome. Thank you, Dr. Harris. And I just want to reiterate that it is, this is an issue that's gotten support from the broad swath of the Christian community, the Jewish community, the Muslim community, the Hindu community. This is an issue that is uniting the faith community, that we believe there should be a paid standard. Before I open it up to reporters for questions, I did want to give a little update on where legislation is right now that will be before the upcoming General Assembly. Senator Avula has a bill that is very modest in scope, that basically requires employers that already offer some sort of PTO or paid sick days to allow workers to use it to care for a sick family member. Sometimes there's a paid sick day policy that only the worker can be sick to use it. And this is a very modest bill that would require employers to allow workers to use that for a sick family member as well. the Paid Sick Day Coalition will support that bill. Delegate Guzman, who has really been a champion on this issue in the House of Delegates, is introducing a bill that is really designed to address essential workers and honestly address some of the concerns that have been raised in the Senate. We've gotten a bill through the House a few times, but not through the Senate. So we're trying to address some of the concerns that have been raised by the senators. This essential workers bill would require paid sick days, 5, for essential workers. And we've outlined 10 or 12 categories of workers that are in that, obviously healthcare workers and educational workers and first responders. So there's a whole set of workers that they would be covered with a paid sick day standard. It is around full-time workers, so again, addressing some of the senators' concerns on this, and with the focus on essential workers. And we've put in a hardship provision. There are some who've said, how can you even talk about a paid sick day standard in the middle of a pandemic and businesses are hurting? Well, as we know, not all businesses are hurting. In fact, some are thriving in this economy. And so we really want to distinguish between those businesses right now. And so again, we've put in a hardship waiver that is an attempt to address some of those concerns that have been raised, but in a way that helps us create good public policy for the long haul. The Virginia Paid Sick Day Coalition is supporting this essential workers bill being presented by Delegate Guzman. Delegate Reed is also planning to introduce a paid sick day bill. And we are grateful for his willingness to get in here and try and figure something out. The coalition, however, is not supporting the bill at this point because it has an exemption level of exempting employers with fewer than 35 workers. We think that exemption is way too broad. That's more than 90% of businesses in Virginia would be exempt from this standard. We think that is not the direction to go. Now, if it were a phase in over a few years so that eventually everyone gets covered, we could support that. But with such a large carve out, the coalition is not supporting it. So that's where we are in terms of what will be considered during the upcoming General Assembly. So let me stop and get questions from reporters.
Hi, can you guys see me?
Yes, hi, Jackie.
Hi, how's it going? Okay, I have a couple questions surrounding Delegate Guzman's bill. So you said it outlined 10 to 12 categories of workers. Does this include restaurant workers? Because I know that like small restaurants have been included in the non-essential category for some of the governor's executive orders and closures. So does that include restaurant workers? Because I know
it does not. You know, honestly, we debated long and hard on this one because obviously restaurant workers are one of the most important workers that need to be covered, but they're also one of the sectors that is so hard hit right now. And so our intention is if we can get this essential workers that covers categories that we think a large number of senators would support. If we can get this, then honestly, we would come back in future years and try and get a much broader package.
And is it your impression right now that some of even the Democratic senators who have blocked this in the past would support that proposal, or is that
we
still
have been
unclear? Told
that we've talked to all of the senators really, and quite a few of them who have opposed it in the past have said, I really think there should be a standard for a bunch of core essential worker categories. They are, however, again, we repeatedly hear concerns about part-time workers, and we hear concerns about businesses that are hurting. So again, we've tried to craft a bill that we think will address some of the concerns of senators so we could get something through the Senate that would make a difference for not all, but a good number of workers in Virginia.
If I could sneak in one more here too, are you concerned that using this essential workers standard, this bill might very well not take effect until we're well into vaccinations and hopefully on the other side of this pandemic. So are you concerned it might not be as applicable to that time period?
Well, again, we all hope that the vaccine will take care of the problems quickly, but I'm hearing that we may well have this virus with us for a while, and so we are calling for an implementation of July 1, which is the soonest you can do without emergency legislation, which is much more complicated to win. And so we do think it will still be relevant for this virus, but even before this, half of all coronaviruses were spread in the workplace. And so again, these essential workers, whether it's this virus or even a cold or normal sort of viruses, they are spread in the workplace. And essential workers are on the front lines, honestly, both doing important work, but spreading these viruses. Mark, I saw you had your hand up. Did you want to respond? Unmute yourself.
I was waving to a customer.
Oh, okay. All right, just fine. Great. Thank you. Jackie, did you have any other questions on that?
I'm all set. Thank you.
All righty. Other reporters.
Hi, this is Sabrina from the Richmond Times-Dispatch. Yeah, I really appreciate you taking the time today. One of my biggest questions is kind of we're approaching that timeline of essential workers potentially getting vaccinated. It's not a definitive timeline, but that's also a population that is predominantly made up of Black and Latino people in Virginia. So kind of what do you foresee being the steps forward, especially since we saw this bill, being killed, less than a year ago? And I just have one follow-up after that.
Well, again, we expect that we can get a bill through the House. We have had strong support in both the regular session and the special session for efforts to get a paid sick day standard. And we are working with senators, and we have been working with senators for the last few months, trying to craft a bill that they can support. And I think we've got in this essential workers bill that Delegate Guzman is presenting, we've got a very balanced approach. We've tried to address the concerns of the senators. It is honestly not our dream bill. It's not exactly where we'd like it, but it is a modest first step that we think would make a difference now, and that we can then look at what happens to those businesses. Is this a huge burden? We don't think it is, as we've heard from our employers on the call today. Yes, there are some costs, but if it's an across-the-board standard, it's one that businesses can manage, and it produces not only happy workers, but good output for the businesses, and obviously important health benefits for all of us. So again, we think we've got a bill that can get through the Senate, and we're excited about the upcoming General Assembly. Thank
you. And one of my last questions, undocumented residents, there are a lot who are in essential work, especially farm workers, construction, very front-facing jobs who are also, getting COVID. So kind of what is your response for kind of what next steps could look like for that, since including undocumented residents has not been, a popular thing in the past? So just kind of wanted to hear your thoughts.
Yes. This bill would certainly cover farm workers. They are frontline food workers, which are considered essential workers in this bill. The bill makes no differentiation between documented and undocumented workers, so it would cover all workers. This is, I think if we'd never thought that farm workers were important, I think we are now thinking that they're important, and they too need paid sick days.
Hey, this is Jake with CBS 6 here in Richmond. I was hoping to ask Josh a question or two, if that's all right.
Go for it.
Yeah, Josh, I'm wondering, you hear all this talk about carve-outs, the number of days and such. Just as you're listening to this conversation, obviously you've been following this, it seems, for a while. Just what do you think when you hear those kind of discussions about something that would directly impact you?
So I certainly understand what the coalition is doing, and I don't fault them at all for, getting past what they can. I think really uh, the responsibility falls on legislators, I guess, a bit more, to not be willing to pass something to protect us, if that makes any sense. And like, while I understand that many small businesses are hurting right now, that's what the government's here for, to step in and help hurting small businesses. And the government can help small businesses help their workers. So I, obviously appreciate the work that the coalition is doing, and I'm looking forward to, legislators passing the bills that were just mentioned. But at the same time, I'm really hoping that we can see some progress for restaurant workers and other workers in the future.
Given that you've worked in the industry for several years, can you think of maybe a story or a situation where you're like, wow, this is pretty inappropriate?
Yeah, without going into too much detail, I've worked in several restaurants throughout the past 6 years, and there was at least one instance that's coming to mind right now where somebody came in sick, and this was way back when I was a teenager. Somebody came in sick and told the manager they weren't feeling good, and the manager was like, "Well, we don't have enough people to cover you, so take some medicine and move on." So like that kind of thing happens, I think, more than we really want to know. Maybe not now with COVID, obviously, I would hope not, but before a pandemic, when it was just colds, which are still serious, it wasn't taken seriously.
Thank you.
Other reporters? Okay, I do want to remind reporters that we have a great poll that Virginia Interfaith and Freedom Virginia issued that shows incredible support in Virginia for a paid sick day standard. 96% of Democrats, 72% of Republicans, for a combined 83% of Virginia voters support a paid sick day standard. So this is a wildly popular policy, and we can see why. It makes sense for business, it makes sense for workers, and right now it makes sense for public health. So we really appreciate reporters joining us this morning. I do want to mention before we close today that we are doing another press conference on Thursday at 10 o'clock on abolishing the death penalty, one of our other priorities. And so we would certainly invite any of you to join us for that this coming Thursday. So thank you. And if you need to be in touch with anyone who's been on the call today, please email Roberta and she will connect you with any of our speakers. If you have follow-up questions, we're happy to address them. Thank you so much, and everybody stay safe.